This is Med School Radio. Welcome back to Med School Radio. This is Simon, and we are going to look at some more first aid summaries. I'm just reading the summaries of the first aid question, which I've saved to my smartphone, and I'm just reading through them. There's some background noise, I'm sorry about that, but thanks for joining me. Let's start off with hereditary spastic paraplegia. This is characterized by progressive degeneration of the lateral corticospinal tract and subsequent lower extremity weakness and spasticity, which is stiffness. The lateral corticospinal tract contains motor neurons that control descending voluntary movements of contralateral limbs. Okay, the next one is about yolk sac tumors. Yolk sac tumors of the testes typically manifest as a testicular mass in infants or young children and are characterized by an elevated AFP level. The tumor can be distinguished histologically by Schiller-Duval bodies, which is pathognomonic for yolk sac tumors, which resemble primitive glomeruli. Next, von Willebrand disease. This is characterized by platelet adhesion defects due to lack of von Willebrand factor and may also manifest with coagulation defects. This is depending on the severity of von Willebrand disease and concomitant reduction in serum factor VIII levels. Patients typically present with easy bruisability and prolonged mucosal bleeding. Bleeding time is elevated and the PTT may be normal or increased. Okay, a short one here. Factors that increase estrogen exposure are associated with enhanced breast cancer risk, for example, late menopause and early menarche. Next, let's talk about metirapone. Metirapone inhibits cortisol synthesis by blocking the conversion of 11-deoxycortisol to cortisol. In response to metirapone administration, individuals with primary adrenal insufficiency develop an increase in ACTH, but their levels of 11-deoxycortisol and cortisol remain low because their atrophic adrenal glands cannot respond to ACTH. Next is granulosa cell tumors. So the summary here says, granulosa cell tumors of the ovary often presents as a large unilateral ovarian mass with signs of estrogen excess, for example with postmenopausal bleeding, thickened endometrial stripe, or precocious puberty. The diagnosis of GCT can be confirmed on histology by the presence of Karl-Exner bodies, which is cuboidal cells in rosettes with grooved nuclei. Okay, the next one we'll look at is E. histolytica. This can be identified by observing trophozoites with phagocytosed red blood cells in the stool. E. histolytica infection manifests as bloody diarrhea with mucus after travel to endemic regions. Liver abscesses may also be present. Okay, this is regarding Cushing syndrome. Cushing syndrome is characterized by weight gain, abdominal striae, moon facies, poor wound healing, and facial plethora. Small cell lung carcinoma can cause paraneoplastic syndromes, including Cushing syndrome, SIADH, and Lambert-Eaton myasthenic syndrome. Ready for another? Let's talk about Hodgkin lymphoma. Hodgkin lymphoma presents with constitutional symptoms and localized peripheral lymph node involvement with mediastinal lymphadenopathy. The nodular sclerosing subtype is the most common form. All right, so let's continue on with a little bit of music. Okay, defective fibrillin in Marfan syndrome predisposes patients to aortic dissection, which may lead to cardiac tamponade. Low voltage QRS complexes with electrical alterans on an ECG are characteristic of this condition. All right, moving on. Antiphospholipid antibody syndrome, or lupus anticoagulant. What is antiphospholipid antibody syndrome, or lupus anticoagulant? This is caused by antibodies directed against platelet phospholipids. It is associated with increased coagulation times, recurrent thrombosis, and miscarriages. So that was antiphospholipid antibody syndrome, also known as lupus anticoagulant. Next is TGV, which is a congenital cyanotic right-to-left shunt. And this results from the failure of the aorticopulmonary septum to spiral. The condition manifests with neonatal hypoxia and an egg on a string appearance of the heart on chest X-ray. TGV, this is transposition of the great vessels. Okay, moving on. We're going to look at elevated alpha-fetoprotein levels in maternal serum during gestation. So elevated alpha-fetoprotein levels in maternal serum during gestation are associated with open, i.e. not covered NTDs such as meningocele or myelomeningocele or encephalocele, and anencephaly. Normal alpha-fetoprotein levels are found with spina bifida occulta. NTDs can often be prevented with adequate maternal intake of folic acid. Next one, let's talk about preeclampsia. Preeclampsia is characterized by hypertension, proteinuria, and edema. At or after 24 weeks gestation, major complications include disseminated intravascular coagulation, or DIC, HELP syndrome, and acute tubular necrosis. DIC is confirmed and monitored by fibrin split products, for example, D-dimers, prothrombin time, partial thromboplastin time, and platelet count. Turn down the music a bit here. Next, let's talk about small cell lung carcinoma. Small cell lung carcinoma is a neoplasm of neuroendocrine Klatsky cells associated with a number of paraneoplastic syndromes, including ectopic production of ACTH, ADH, and Lambert-Eaton syndrome. A low alpha-fetoprotein level with an increased beta-human chorionic gonadotropin level indicates possible Down syndrome, which is associated with ventricular septal defects, endocardial cushion defects, and omphalocele. Take a little bit of a break here. Okay, let's continue on. Carcinoid tumors. Carcinoid tumors secrete excessive serotonin. If extraintestinal metastasis is present, symptoms that may manifest include bronchospasm. That's not a sound effect, guys. That's real. That's going on outside. 1 second. Okay. Carcinoid tumors secrete excessive serotonin. If extraintestinal metastasis is present, symptoms that may manifest include bronchospasm, cutaneous flushing, watery diarrhea, and right-sided heart murmurs. Treatment includes octreotide to reduce serotonin levels before surgical excision of the carcinoid tumor. Serotonin is decreased in patients with depression and anxiety disorders. So that is carcinoid tumors. Next, let's talk about intraparenchymal hemorrhage. Intraparenchymal hemorrhage is most commonly caused by systemic hypertension, although other risk factors include amyloid angiopathy in the elderly and less commonly neoplasia. Signs and symptoms include headache, vomiting, decreased level of consciousness, and increased intracranial pressure. So that was intraparenchymal hemorrhage. Okay, the next one is follicular lymphoma. Follicular lymphoma, showing nodular collections of lymphoma cells in a lymph node, expresses BCL2 as a result of T1418 translocation. Patients usually present with painless lymphadenopathy. That was follicular lymphoma. Next, patients with tuberculosis should be placed in an airborne infection isolation room, or AIIR, and all the airborne precautions, along with standard precautions, should be employed to prevent aerosol transmission of the pathogen. Granulomatosis with polyangiitis is a C-ANCA-positive vasculitis with necrotizing granulomas in the lungs and upper airway. It is associated with necrotizing glomerulonephritis. Next, let's talk about Hirschsprung disease. It is a congenital megacolon caused by failure of neural crest cell migration, causing congenital absence of Auerbach and Meissner plexuses. A characteristic finding is failure of meconium passage. In older men with back pain and symptoms of prostate cancer, metastasis to the bone should be considered and is far more common than primary cancers of bone. Next is 5-alpha reductase deficiency. This leads to failure of development of normal male external genitalia, often resulting in a phenotypically female 46XY infant. The increase in testosterone levels during puberty often results in masculinization of the external genitalia. Additionally, the adolescent may present with a report of primary amenorrhea. Osteoarthritis is a chronic disease of degenerating joints in which pieces of cartilage and bone are broken off into the joint space, causing pain and restriction of joint movement. Unlike other pathologic joint processes, no typically frank histologic evidence of inflammation is associated with osteoarthritis. Take a little break here. Okay, and we are back. Let's talk about CML. CML is associated with a 922 translocation that results in the BCR-ABL fusion gene that encodes a constitutively active tyrosine kinase, or BCR-ABL protein. Imatinib is used to treat this condition. Next, with a third nerve or cranial nerve 3 palsy, the actions of cranial nerves 4 and 6, which innervate the superior oblique and lateral rectus respectively, are unopposed, leading to intorsion, depression, and abduction of the eye at resting gaze. Cranial mononeuropathy, particularly of cranial nerve 3, is a common type of diabetic neuropathy. Acute hepatitis C commonly goes undetected, and 60% to 85% of patients will eventually manifest chronic hepatitis. Acute hepatitis C infection is defined by the presence of viral RNA and the absence of antiviral antibodies. Excessive exogenous levothyroxine taken by a healthy individual will cause an increase in free thyroxine and a lowering of thyroid stimulating hormone, or TSH, of the anterior pituitary via negative feedback. Seborrheic keratosis is a benign neoplasm predominantly seen in the elderly population and frequently increases with age. ALL is associated with Down syndrome, a congenital disorder caused by trisomy of chromosome 21. Infection with Giardia lamblia causes an acute, non-bloody, watery, foul-smelling diarrhea. It is transmitted via the fecal-oral route in contaminated food or water. It occurs throughout the world, but is mostly related to places with poor sanitation. The easiest way to diagnose Giardia is by finding trophozoites in the stool. A patient with an amoebic abscess presents with fever, abdominal pain, and a liver mass detectable on ultrasound. An amoebic abscess develops weeks or months after a patient presents with classic signs of amoebiasis, including bloody mucoid diarrhea and recent travel to a developing country. Treatment with metronidazole is indicated and followed by aspiration if medical therapy fails. Clostridium difficile infection is frequently due to recent antibiotic use and presents with high fevers, leukocytosis, and diarrhea. Two toxins released by the organism cause the diarrhea. Both toxin A and toxin B are cytotoxin, but toxin B is more important. Next, rotavirus. Rotavirus is a common cause of viral gastroenteritis in unvaccinated children 6 months to 2 years of age. Symptoms include watery diarrhea, abdominal pain, and dehydration. Rotavirus is a member of the reovirus family and is a double-stranded, linear, segmented RNA virus. Take a short break. Okay, we're back. Let's continue on. And for those of you who are just tuning in, I am just reading the summaries that are presented from the first aid questions. I save them to my smartphone and I just read them back to myself as a review of the questions. It's a great method, and I recommend you do the same. Bloody diarrhea after exposure to unfiltered water in endemic countries such as Mexico and India and areas of Central and South America is suggestive of infection by Entamoeba histolytica. Trophozoites with ingested red blood cells may be seen on microscopic examination of an infected patient's stool. Von Willebrand disease is the most common inherited bleeding disorder. It is caused by dysfunction of von Willebrand factor, and laboratory findings include a prolonged bleeding time. About half of affected patients will have a prolonged partial thromboplastin time, since von Willebrand factor is the carrier for factor VIII. Obesity is a significant risk factor for endometrial carcinoma. In addition, any condition that increases estrogen exposure increases the risk for the development of endometrial hyperplasia or carcinoma. Recurrent hemarthrosis and easy bruising in the setting of isolated elevation of PT suggest a problem with the extrinsic coagulation pathway. A normal APTT value indicates that the intrinsic pathway is unaffected and therefore points to factor VII deficiency and is the most likely diagnosis. At 5 to 10 days after an MI, patients are at risk of ventricular wall rupture, causing blood to spill into the pericardium, resulting in tamponade. This results in chest pain, sudden onset of severe hypotension, and unresponsiveness. Asbestosis typically presents with non-specific findings, including dyspnea and cough. Characteristic findings include ferruginous bodies, asbestos fibers coated with iron and calcium, and pleural plaques. Dense layers of collagen fibers that accumulate on the pleural surface. When stained with Prussian blue, asbestos fibers resemble blue dumbbells on microscopy. Prostate cancer most commonly affects the peripheral zone of the prostate. transposition of the great vessels is not compatible with life unless a VSD, ASD, or PDA allows mixing of blood between the two separate circulations. Treatment with prostaglandin E can maintain patency of the ductus arteriosus. Next, intussusception is the telescoping of one segment of bowel into another, resulting in obstruction, and is most common among children younger than 5 years. It presents with colicky, abdominal pain, and vomiting, which can indicate worsening of the obstruction. Nephrogenic diabetes insipidus is a rare condition caused by a variety of different mechanisms, one of which is a side effect of lithium. Nephrogenic diabetes insipidus is characterized by a minimal change in urine osmolality after water deprivation test, which determines the diagnosis. Carcinoid tumors secrete serotonin, causing flushing, watery diarrhea, and right-sided valvular lesions. 5-HIAA is a metabolite of serotonin that can be detected in the urine. Parvovirus B19 is the causative organism of fifth disease, erythema infectiosum, which is characterized by an erythematous rash on both cheeks. Kaposi sarcoma, with its spindle-shaped tumor cells, is due to human herpes virus 8 and is found commonly in patients with AIDS. Tetanus toxin blocks glycine and GABA release from inhibitory interneurons in the spinal cord, which results in facial grimacing, which is called rhizus sardonicus, and back arching, which is opisthotonus, from severe muscle spasms, and ultimately death if untreated. Staghorn stones composed of ammonium magnesium phosphate strovite are caused by infection by urease-producing microorganisms, most commonly Proteus klebsiella and Staphylococcus saprophyticus. Short break. Once again, thanks very much, everybody, for tuning in. I'm really enjoying reading these out loud, and I've had some positive feedback. I find that reading questions and answers out loud really helps in my preparation for the USMLE. Okay, let's continue on. Next, we'll talk about Staphylococcus epidermidis and other coagulase-negative staphylococci. Is a part of normal skin flora and can cause infections, including peritonitis, in the setting of indwelling prosthetic devices or catheters. It is the most common cause of dialysis-associated peritonitis, with Staphylococcus aureus being the second most commonly implicated pathogen. Acute hepatitis A infection frequently occurs in travelers to areas with poor sanitation and those who eat contaminated raw shellfish. It is transmitted fecal-orally, most commonly in water or seafood, and has a self-limited course. The main clinical manifestations include nausea, vomiting, malaise, abdominal pain, jaundice, and bilirubinuria. Hepatitis A is not associated with a carrier state and has no increased risk for HCC. Next, post-infectious glomerulonephritis presents between 1 and 3 weeks after a streptococcal infection, skin or throat, with a nephritic syndrome. A type 3 hypersensitivity reaction is characterized by antigen-antibody complexes that lead to complement activation. Okay, this summary is referring to a patient that presented with signs and symptoms of cirrhosis caused by hepatitis C infection. HCV is an enveloped single-strand positive linear RNA virus with icosahedral capsid that belongs to the flavivirus genus. All RNA viruses replicate in the cytoplasm except influenza and retrovirus. TMP-SMX is one of the first-line therapies for uncomplicated urinary tract infections and acts by blocking the synthesis of folate, which is essential for nucleotide synthesis. In young women, most UTIs are caused by E. coli, with the remainder caused by Staphylococcus saprophyticus, Klebsiella pneumoniae, and several other less commonly seen species. E. coli, which ferments lactose, is the most common cause of urinary tract infections in sexually active young women. E. coli is a potential cause of gastrointestinal disease. The EHEC strain can be responsible for bloody diarrhea when it obtains Shiga-like toxin from a lysogenic phage. It can cause hemolytic uremic syndrome, characterized by hemolytic anemia, thrombocytopenia, and renal failure. Parvovirus B19 is the causative organism of fifth disease, erythema infectuosum, which is characterized by an erythematous rash on both cheeks. Kaposi with its spindle-shaped tumor cells is due to human herpes virus 8 and is found commonly in patients with AIDS. So you can see there's some repetition, some of the questions resemble each other, but it's good to repeat so we can send these concepts home. Okay, tetanus. Tetanus toxin blocks glycine and GABA release from inhibitory interneurons in the spinal cord, which results in facial grimacing and back arching from the severe muscle spasms and ultimately death if untreated. Yes, we've done this before. Next one. Community-acquired pneumonia caused by Klebsiella pneumoniae, a gram-negative rod, often affects patients who are malnourished and debilitated, including individuals with a history of chronic alcoholism. Ceftriaxone, with or without an aminoglycoside, would be an appropriate treatment. A new onset murmur in patients who use intravenous drugs is most likely a sign of endocarditis caused by Staph aureus. Symptoms of bacterial meningitis include fever, headache, nuchal rigidity, and a non-blanching petechial rash. CSF analysis shows an elevated opening pressure, elevated protein, decreased glucose concentration, and significant pleocytosis of white blood cells with a predominance of neutrophils. Aspirin acts by irreversible COX-1 and COX-2 inhibition. Epigastric pain, suggestive of gastric ulcers, and ringing in the ear, tinnitus, are both classic symptoms of aspirin toxicity. Other signs and symptoms include early respiratory alkalosis, followed by a high anion gap metabolic acidosis. I'll repeat that. Other signs and symptoms include early respiratory alkalosis followed by a high anion gap metabolic acidosis. Chronic pancreatitis commonly manifests as a malabsorptive diarrhea, since the pancreas is no longer capable of secreting an adequate amount of amylase and lipase, which are responsible for the digestion of carbohydrates and lipids. Consequently, fats remain undigested in the intestines, which results in malabsorptive diarrhea. It is imperative to try and prevent any and all post-surgical infections. Prompt removal of Foley catheters after they are no longer required is an important preventative measure. Screening for host antibodies to HIV with ELISA, E-L-I-S-A, high sensitivity, is the initial method of HIV diagnosis. Western blot analysis was used for confirmation, which has high specificity, but the most common CDC guidelines recommend confirmation with HIV half or 1/2 differentiation immunoassays. LTC4, LTD4, and LTE4 are bronchoconstrictors that cause asthma symptoms. Anti-leukotrienes such as Xeluton and Montelukast and Zefirlukast are often prescribed as adjunctive treatment for asthma. So I know I'm just reading through these very quickly, but the idea is that you're getting a quick review in listening to me run through these very quickly. The problem with studying for the USMLE is that we have to do it within a short period of time, and if you don't do it within a short period of time, you lose a lot of this information, so you need a quick review. So that's what I'm trying to do here. Next, insulinoma. An insulinoma, a component of MEN1 syndrome, is a benign tumor of pancreatic beta cells associated with increased insulin production. Insulin is originally synthesized as pre-proinsulin in the rough endoplasmic reticulum. Methotrexate, used for persistent rheumatoid arthritis, blocks dihydrofolate reductase. Dihydrofolate reductase is part of the pyrimidine synthesis pathway. The adverse effects of methotrexate are caused by depletion of folate in the body. So I think we'll stop there. Thanks very much for joining me for this session. I might do this again in the future, as I find this a good review for myself. So please tune in again, and thanks very much for tuning in to Med School Radio. So please join me again. This is Med School Radio.